Video number 1, Reoperative Transaxillary breast augmentation and fat grafting. This is the case, 45 years old patient with 2 previous breast augmentations. Breast asymmetry, Camp cone, Baker 4 on the right, Baker 2 on the left breast. Pinch test of 1.5 centimeters. Here you can see the patient with the arms up, and the patient presents and complains about implant tips and palpability. This is the oblique view, the right and left side showing the asymmetry, and the profile view where you can see the difference of the position of the EMF and the difference of the lower pole arc between the right and left sides. And this is our marks, the sternal midline line, the difference between the right and left side of the Niporella complex, and the medial limit of the pocket, the parasternal line, and the lateral limit, the anterior axillary line. Here you can see the distance between the lateral and medial limits, the breast base, 11.5 centimeters, and the current EMF. According to the implant base, we can select the superior breast line and the implant pocket dimension. We classified as zone 1 of fat grafting, a crescent shape located in the upper pole in contact with the pocket. Zone 2 in contact with the zone 1 and more close to the infraclavicular area. And zone 3 on the parasternal area where you define the intermammary distance, as you can see here. This is our 3D scanner analysis where you can see the difference between the breast width, the nipple to EMF distance, intermammary distance, and the volume between the right and left side. And here you can note very clear the intermammary distance in the preoperative. It is almost 3.4 centimeters. On the MRI, you can note the difference between the right and left side. Baker 2 on the left and Baker 4 on the right. The implant presents a lot of folds, and you can note very clear the EMF asymmetry when you compare the left and right side. In the operation table, we define again our preoperative marks. Here you can see the pinch test less than 1.5 centimeters on the upper and medial poles. We define the superior breast line and then the zones of fat grafting, zone 1, 2, and zone 3 as we defined it before. And then we calculate and locate the axillary incision in the deepest axillary fold and usually following the previous axillary scar. Here you can note the instability of the implant and the difference between the right and left side and a large intermammary distance. On the right, you can see implant tips and a palpability of the implant.